Hi, my name is Bethan and I'm a PhD student at the University of Edinburgh. Today I am here to give you a brief overview of a paper recently published by my colleagues and I in the Journal of Child Psychology and Psychiatry entitled Eye Tracking for Longitudinal Assessment of Social Cognition in Children Born Preterm. Preterm birth is associated with increased risk of cognitive impairment and social difficulties in childhood. Difficulties with social interaction can cause educational underachievement and affect social and occupational functioning in adulthood. Socioeconomic deprivation is also known to impact language and interactional abilities in childhood, including in those born preterm. One of the challenges to improving long-term outcomes for the preterm population is early identification of children that will go on to have social difficulties, with the understanding that the preschool years may offer a period of development where interventions may yield the most benefit. In order to do this, we need precise and practical measures of cognition in the early months, coupled with the understanding of how these early measures relate to later outcomes. Gaze is the control point for the intake of visual information, and we can use gaze behaviours in response to visual stimuli in pre-verbal children to make inferences about underlying cognitive processes such as attention and preference. Eye tracking can provide an objective measure of gaze that is highly resolved in time and space. Gaze studies in preterm infants have shown a consistent pattern of reduced social attentional preference. However, the stability of these differences over time and whether they contribute to the ontogeny of neurodevelopmental and/or cognitive impairment are unknown. Therefore, we used eye tracking in preterm and term-born infants to investigate social attentional preference in infancy and at 5 years, its relationship with neurodevelopment, and the influence of socioeconomic deprivation. Our cohort was the first phase of the Their World Edinburgh Both cohort, consisting of 81 preterm children born at or at less than 33 weeks gestation and 66 healthy term controls. We collected socio-economic data at recruitment using a multifactorial measure, the Scottish Index of Multiple Deprivation. We performed eye tracking assessment in infancy between 7 to 9 months corrected gestational age and reassessed a subset at 5 years chronological age. At 5 years, we also performed formal neurodevelopmental assessment using the Mullins scales of early learning. We used 3 free-viewing eye-tracking tasks of increasing stimulus complexity. We calculated a proportional looking score to the predefined areas of social interest for each task, which you can see on the screen there. This was defined as the ratio of the mean looking time to the social areas of interest to the mean looking time to the scene as a whole across all stimuli. We also created an overall social preference score for each individual, calculated from the average PLS for each task. And here are our findings. Children born preterm demonstrated significantly reduced preference to social information across all 3 tasks, and consequently for their overall social preference, compared to their term-born infants at 7 to 9 months of age. However, at 5 years, there were no significant differences, with preterm infants showing increases in their social attentional preferences over time. Indeed, there were strong and significant correlations between the baseline scores in infancy and the difference in scores observed between the 2 time points, in that lower scores at baseline corresponded to greater increases in the 5-year scores. In contrast, the term-born infants simply showed a regression towards the mean. In addition, we found that low gestational age and socioeconomic deprivation were associated with reduced social preference scores at 7 to 9 months. At 5 years, the preterm infants had lower scores on the Mullins scale of early learning than the term-born children, driven by deficits in the language domains, but this was not associated with social attentional preference in infancy. Our study demonstrates that preterm infants have reduced social attentional preference at 7 to 9 months compared to term-born controls, but equivalent social preference by 5 years of age. Despite this apparent catch-up, preterm infants continue to demonstrate poorer performance in standardized neurocognitive testing at 5 years, and it is known that a subset of children born preterm go on to have social difficulties. It is possible that the deficit in children's more complex social abilities, such as language or interactional skills, is secondary to reduced social attention during a sensitive window of development in infancy. However, in our study, we did not find a relationship between attentional preference in infancy and later neurodevelopmental scores. Therefore, it is possible that other measures of cognitive function, such as language ability, are required to determine the role of atypical infant social cognition in later childhood outcomes. In addition, we found that socioeconomic deprivation significantly influences social attentional preference in addition to gestational age, with maximal effects in infancy. This is particularly interesting as socioeconomic deprivation is known to be associated with impaired language development, including among children born preterm, suggesting that the combination of preterm birth and socioeconomic deprivation may present additive risk for cognitive difficulties. Further work is required to determine whether and how infant social cognition plays a role in the ontogeny of cognitive impairment and social difficulties, which are all more prevalent among our preterm population. Our data also suggests that socioeconomic disadvantage should be considered in all studies investigating cognitive development of children born preterm. Thank you very much for watching this video abstract. If you would like to read the full paper, it is now available open access at the Journal of Child Psychology and Psychiatry's website.